Hi, myself is Shalini Bhardwaj. You all are watching ITV Networks Medically Speaking. So today we are going to discuss about the vaccination. So what would be the age limit for vaccination as well as how to go about it and what would be the price? So we are going to discuss about all these things. So we have with us on our panel Dr. S.K. Sarin, who is the director of ILBS Hospital. We have with us Dr. K.K. Aggarwal, who is the former president of Indian Medical Association. We have with us Dr. Sandeep Mishra, who is a professor and cardiologist of All India Institute of Medical Sciences. So, you all of you, sir, welcome on the panel of Medically Speaking. So, we are going to discuss about the vaccination. Dr. Sari, sir, my first question is that people are very much confused. They don't know how to sign up, how to register. What would be the procedure of all these things?
Thank you, Shalini. I know most people are excited, and that's why they are worried that will they get the jab or not. I think the process has been simplified now. The online registration starts from tomorrow, maybe the after the launch of the program, maybe by 12 or so. So you can register online yourself. There would be forms in that where you can fill up. You can choose the hospital. There is no bar on going interstate. You are in another state. You don't have to go back to your state to get a vaccine there. So once you fulfill the criteria, and which are also very clearly laid out, if you are above 60, you're in. If you're above 45 and you fall into any of the 20 categories, which are already clearly listed in the form, you can certainly get the registration. So the first thing is online registration. If you register, or your society or your organization or RWA or can register you online, then you are one of those who will get a priority. After that, there would be some space for walk-ins, but just to avoid the crowd, I think initial few days it will be a slow process. So get yourself registered online. This is a simple COVID 2 app which will be available from tomorrow. I think it will be easy for people.
That's true. Dr. K.K. Aggarwal, sir, what would be the cost of vaccines and what are those vaccines?
To both the vaccines will be available, Covaxin as well as Covishield. The cost has been fixed by the government. In the government hospital, zero cost. And in a private sector, it will be 250 rupees per vaccine, which will mean 500 rupees for a vaccine. Important thing is that the private sectors, once there is out of these 250 rupees, 100 rupees are for providing a service. The private sector will have to also make a consent form, because this will include, the government has not said whether Consumer Protection Act will not be applicable on this. Therefore, private sector may have some hitch in even preparing a consent form, and that consent form should be transparent. It should mention about the cost. If in case the patient needs to be observed for 6 hours, 8 hours, 9 hours, get admitted in a hospital. So all those things, and it also need to have an undertaking from the patient, because what happens is now there will be a dichotomy in the patient's understanding. To insurance company, they say to the doctor, don't write my illnesses. And now they will say, write my illness so that I'm included into 45 to 60 years of age. So these are the implications which will come in private sector. They have to be very, very, very clear, because if a patient over tells his diagnosis or her diagnosis, they may end up into an insurance claim getting cancelled forever. So these are the intricacies which will come when you start getting independently with the responsibility of a private sector.
Sir, one more question. If somebody wants to go to the private hospitals, get itself vaccinated, so it will be hospitals are going to charge some extra money for the procedure, or they are going to charge only vaccine charges, that is 250 rupees, that includes 500 rupees for 2 doses.
See, if a patient is asthmatic, if a patient needs an evaluation whether he is fit or not, whether the hospital will waive off those charges, I don't know. That the hospital will have to decide, but they have to be transparent. If the patient is high risk, If he needs observation more than half an hour, will the hospital charge for it? We don't know. If the patient develops a delayed reaction after 4 hours, if he comes to the hospital again for observation, that these are the things which still we don't know. Therefore, every hospital has to be transparent what we do. Remember, this is a goodwill time. Every hospital, nursing homes have already started approaching public. Come to us, we will assist you. It is a goodwill time for the councillors, member of parliaments, and MLAs, because now when there is an election mood, the voter is not going to ask you for anything except for a vaccine. The voter is going to say, help me in getting my family vaccinated. I'm not talking about illegally, legally get it vaccinated. So therefore, this is going to be a goodwill time for everybody. Everybody will try to see कि दुख में मैं तुम्हारे सिर्फ नहीं काम आया, because when it was a COVID, people were afraid of helping others in terms of going personally, picking them up, or to the taking the hospital. But this will not happen in a vaccination time. It's a goodwill time. I have already started receiving messages from various hospitals that if you have anybody in your family over the age of 60, call this coordinator, they will assist you in getting the vaccination. So that's expected and that's a good sign, and that's what Indian Sanskriti is, to help each other. But my only objection is one thing, and my objection is they should not have discriminated high risk and very high risk individuals of less than 45. The reason being, if 20,000 centers starts from tomorrow, even if it is 30,000 centers tomorrow, 200 each, you will not cover more than 18 crore in 2 months, because they require 18 plus 18, 36 crore double vaccination. In that case, this 30 crore may take 6 months to 8 months. And it is not fair to have a person who is 1 day short of his age of 45 with a renal transplant or a cardiac transplant being denied. So all cases of very, very, very high risk should have been included, not only those above the age of 45.
Dr. Sandeep Mishra, my next question is to you, sir. Do you think still there is a vaccine hesitancy? People are not coming out to get themselves vaccinated, whether they are frontline health workers, we can talk about, or healthcare workers. Still, India is facing vaccine hesitancy.
Yes, I would say that some people, I think, still are having this hesitancy. Although I think majority have got the vaccination done. The reason is, I think, twofold. Number one is that people now feel that the COVID cases are already coming down, so there is perhaps no need to get vaccinated, I mean, some kind of feeling that herd immunity has been achieved, which is a wrong feeling. But some people do harbor these kind of feelings. Number two feeling is that there are some myths associated with vaccines, that people feel that they might have some complications because of vaccine, particularly the allergic complications. People are worried, and I think there should be some broad discussion on what kind of allergies are there, which make people, which allergies people can get vaccinated, and which kind of allergies people should avoid getting vaccinated. I think there should be more discussion on this area regarding the possible complications, which are very few. And then some people still harbor the myths that they can these vaccines can affect their genetic or reproductive status. So those myths have to be
That's
very
true.
clearly
These messages are
dismissed.
circulating in social media platforms also.
So they have to be, very forcefully be rejected, these kind of things. But there has to be a bit more discussion on allergies, because egg protein allergy, sulfur drug allergy, and these kind of things, people do harbor some reluctance if they have any of these things. So what kind of allergies? I think, for example, we know that serious egg protein allergy is something that perhaps one should avoid getting vaccinated. But short of that, other allergies, if they have been minor and they have not led to need to get hospitalized, I think those people still can get vaccinated. But I think there needs to be more discussion on this.
Sir, but how people will know about these particular allergies? Do we have particular tests to go when if somebody wants to know they are allergic to a particular thing or not? So do we have such tests?
So, because this area, is not been investigated in great detail, so there is a need for more information on this. But there are some tests available which talk about, some of these allergies. But I mean, on a mass scale, I don't think they are practical. So the basic thing is that if somebody is not known allergic to anything, is more or less no problem. If somebody
So
has had a history of very serious allergy, anaphylaxis or some very serious allergy, then I think they need to get investigated, be
we
more
have with us,
careful.
Sir, we have with us Dr. D.S. Rana, who is the chairperson of Sir Gangaram Hospital. Sir, what you would like to say about these particular allergies?
I'm not expert on this, but I know that people those who have got energy and allergies, they are likely to have little more reaction to any drug, including vaccines. So, but there is as large scale as Doctor he just told that is not possible to know this and test these things. You have to just have your medical kit ready for getting any this thing, or maybe that such people may avoid vaccine and stay at home. But
Dr. Sir,
Dr. KK Agarwal, KK
I just
Agarwal,
want to
that's
add.
a very nice issue that the people having advanced kidney failure, people having transplant, and also people having younger people having ischemic heart disease. They are also very prone as far as disease is concerned. There is no doubt that with advancing age, there is more risk of getting morbidity and mortality. But this is also a big question which need to be addressed. I hope hopefully after 2 3 months, vaccine should be freely available. Before that, many people will be very sort of they will be interested in getting vaccine. How to sort out this issue because right now we require age proof, so it will become very difficult.
I just want to add about the allergic component.
yes, sir.
There are two types of allergies when we go for a vaccine. One is IgE and second non-IgE. Both can occur with COVID-19. The IgE anaphylaxis has not been seen till today in India, but it can occur. In Moderna and Pfizer, it was due to polyethylene glycol, extensively used by Dr. Sarin in GI practice. And the second is polysorbate 80, and that is present in both Covaxin and Covishield, which is a brother of PEG and can cause anaphylaxis. So those people who have had history of anaphylaxis in the past to anything, doctors can do a refresh tear drop test. Refresh tear is the tear which you put it in your eyes for dry eyes. That's easily available. That contains polysorbate 80. And if you put it in your drop and if you have no redness, you know you are not hypersensitive to polysorbate 80. So all those people, only if you have had not allergy, a severe anaphylaxis in the past, you only need to rule out a polysorbate 80 anaphylaxis, which you can do it outside. Otherwise, to take care of non-IgE mediated, which is complement mediated allergy occurring couple of hours after the vaccination, we are suggesting them pre-medication. If my patient is there, I will pre-medicate them with Montelukast, H1 blocker and H2 blocker. Continued a day, started a day before, continue for 3 more days to cover up for those patients who have allergy where I am not sure that they may be having an underlying non-IgE mediated allergy, which requires pre-medication, which is a standard protocol.
That's important, sir. Very important message. Dr. Sarin, sir, very common question, but it's still there is hesitancy. Why somebody should get vaccinated? Why it is so important?
Uh, the virus can invade as it was last year, So once this virus comes and you have no immunity, you know that this is sometimes fatal and the fatality rates are higher, it spreads fast. Vaccine gives you four kinds of benefits. If you have a immune reaction to the vaccine, means you make antibodies, then the virus, when it comes to the person who has got antibodies, will be in a way annihilated. Virus will not be able to cause a major injury. So the disease and the infection will be much milder. Second, if the person gets the infection and there is a low level viremia, he will not be able to transmit. Third, the benefit of this is a mutant virus. Suppose the virus changes its shape and it comes to our people in the country, which is a fear in Mumbai, Maharashtra, then this person who is already vaccinated will have reasonable immunity. I may not be able to say today till next week or so that how much is the efficacy of these vaccines against mutants, but yes, if not 95%, at least 75% will be a benefit. And fourth and more important is that his family where he is living will not get any further infection. So there are several benefits of vaccine. Both the doses of the vaccine must be taken as of now. One dose is not enough. And of course, we should try to vaccinate as many people fastly that possible to get the first dose. But there is no question asked now about the efficacy or the safety of this. I think 12, 13 million people have been vaccinated. One more important issue is if you are living in an environment where there is high endemicity, for example, Maharashtra, now pandemic is resurging there. I think these areas must be very strongly watched, very rapidly vaccination. For example, there is a major festival like Kumbh or others. Now, the areas where there is a likely aggregation of people, I think those areas must be closely watched. In the five states where there is a surge, I think there is a need for us to watch. We have to see that the containment and the prophylaxis by vaccination is given to all those where there is a likelihood. So the advantages of vaccination and rapid vaccination are immense. I don't think we should question anymore. The science has done enough. It has given you the vaccine. Now the bigger achievement than vaccine development is acceptance and getting the vaccine.
Dr. Rana, sir, my next question is from you, sir. What would be the cost of vaccine? And if somebody wants to come to the private hospital, get vaccination done, so what would be the procedure, as well as the vaccine cost is 250 rupees, and if we talk about double dose, that includes your 500 rupees. Does it going to include all the procedure a patient is going through, means a beneficiary is going to through? Somebody comes to your hospital like Sir Gangaram, and he or she wants to get vaccinated, so are you going to charge only vaccine fees, or you are going to involve other charges also?
Only vaccine fees, which is already told by government, 2 rupee 50. You can't charge more than 2 rupee 50.
Does it going to include, sir? Yeah, sir, please continue.
No, it is as far as vaccination is concerned, it's going to be the same. Only 250. You can't charge him single paisa more than that.
I have a question with Dr. Rana, that if a patient gets a reaction and get admitted for 8 to 12 hours or need a overnight stay, I don't think so private sector is going to cover that cost.
Yes, sir. Dr.
It
KK,
needs to be transparent from, because either they charge.
let us be transparent. If it is a very occasional episode, then I think we should be able to tolerate it, or we should be able to take it. But otherwise, let us say you are getting a lot of reactions.
My another question is, if a patient is high risk, if he comes for I don't think so you're going to blindly give a vaccination to a person who is very, very, very high risk without evaluation. So either you will refuse, and if you evaluate, suppose somebody's blood pressure is very high at the time of vaccination, or he is diabetic, or he is a comorbid conditions, either you will refuse or there will be an evaluation. So this has to be, you as a hospital may say, yes, we are going to do it free, but it should be transparent. Government should decide whether either we should say go to the government hospital, So all those people who are very, very comorbid conditions, in such a situation, if it is free, it's a very good goodwill we are giving to the public. If not, it should be transparent. That's what I'm saying.
I agree with you, but there is no policy right now. Once the whatsoever the government will say, you have to agree for that, and that's what I say.
That's
Right, you are right. Yeah, your question, you're raising a very pertinent question. But right now, whatsoever direction we have got, I think we have to uh, take up that cost.
Another thing which I'm asking is, you are charging 100 rupees for service charges. You will be available in a Consumer Protection Act from tomorrow. Once you charge 100 rupees, whether the government say or not, you will be under Consumer Protection Act. Therefore,
I really don't know.
therefore consent should be taken. I'm not
Yeah,
defining anything.
I agree. Okay, you are going in very good details, but everything is being done in the interest of general public. So
Agreed. I'm only saying it, take a consent. That's what. I'm not saying
yeah,
deny it.
consent.
Take a consent.
Yeah, consent has to taken.
As on today, I got vaccinated. I didn't sign any consent form. So in a private sector, make a consent. Ask all the hospital to make a consent form. Let the consent be taken. That's what I'm only trying to
Yeah,
say.
yeah, yeah. I
important.
fully agree. Without consent, we should not give vaccination to anybody, whether young, old, or whether comorbid
So,
disease.
Dr. Shiv Sarin wants to add.
Yeah.
Yes.
I would like to clarify, once you register online, you are voluntarily giving a consent. You are shown all the facts. I therefore think into, unless you have a specific comorbid like post transplant or something, I think for general people it should be clear. If you are signing up online, you fill up the forms, you know about the vaccine. I think to simplify the process, I would say vaccine consent is not a part of a vaccination. This is a voluntary act.
Yeah,
It was
Consent is
But
voluntary
required
as long as you were
can I
not
can I say
charging the
something?
service charges.
Yeah.
for which
Can I can
the
I say
patient
something?
is not the doctor is doing a procedure, then you require a consent. But I think for a voluntary participation, I would be hesitant, but maybe you have other opinions.
You are paying for it. Once you were not paying, it was okay. Once you pay, it becomes a service.
Yeah.
Even if it is 1 rupee.
Dr.
Even if
that is
it
Sandeep,
the
is
what
difference.
you would like to say?
Yeah, so I got vaccinated at AIIMS, and while it was free, and I think it was free till yet for everybody, but we did sign a consent form, and in which it was in detail explained. I don't know why others did not give a consent form, but in our place, even if it is free, everybody is signing a consent
because
form,
of Covaxin.
and
Because of Covaxin. You had Covaxin, which is under a
yeah,
trial. The consent was
yeah,
a necessity.
Hmm.
okay.
That's what the
But I think it's a fair enough that a consent should be signed. I think
That's
that's a good
important. A consent should be important.
suggestion.
Yeah.
Yes. Yeah.
Dr.
Yeah, I
K,
think what Dr. Srin said, that is also okay. But in spite of that, we should still take consent, and that's all.
Dr. KK, sir, what would be the, what are those documents which a beneficiary to have itself when somebody comes for the vaccination in the hospitals? What are those ID proofs which are required?
multiple ID proofs have been sent by the government. The best will be any ID proof which is approved by the government. And the easiest and the best will be an Aadhaar card. Otherwise, any other government proof is applicable. So I would
Aadhaar card
say,
and voter ID is what they have said.
yes,
Aadhaar
Aadhaar
card
card
and
or
voter
voter
ID.
ID. Aadhaar card or voter ID. These are both are linked to each other. So
Yeah.
anything
And
which has a link to Aadhaar card will be the applicable. Otherwise, you can go with the driving license and other things. But I say this is one thing everybody will have. That will be Aadhaar card or voter ID. That's what I carried with me. I only carried Aadhaar card with me, and it was done.
I think you all got yourself vaccinated, sir.
yes,
I
Dr.
got
Sir,
both the vaccines.
that's very important, sir. Dr. Sarin, sir, what are the other vaccine candidates which are in the pipeline?
Well, you must have read about the J&J, the single dose vaccine, which is just approved by FDA. I think it's an amazing feat that single dose can give you. There is no other vaccine where you just give one dose, because normally vaccines work on a principle of showing a trailer of the invader. So they give you a small protein, a small dose of dead virus or inactive virus as the first thing, and that itself gives the body a opportunity to make immune cells ready if the virus really acts. And the second dose means that when you give it, then the body has full blown machinery to tackle. So all vaccines, whether it is hepatitis B or polio and others, they are generally given in 1, 2, or 3 doses. So J&J vaccine is a very big example of scientific achievement. It can give you good. Yeah, other than that, now the nasal vaccines are on the way. India is also making. The Chinese have made it. That's a very good vaccine. India is likely to have maybe Sputnik, which is a two-dose vaccine, 3 weeks apart. That's developed by the Russian Institute, and Dr. Reddy's is making. There are two other vaccines in pipeline. Serum Institute is also making another vaccine which is using different combinations, and another very good vaccine is by Zydus Cadila, which is likely to come into market. They also are making a nasal vaccine. So I think we may have by next 2 months 7 to 8 more vaccines available, and the variant vaccines which are being developed by both Moderna and Pfizer for mutant virus are also likely to be continued. So I think we are hoping for big. Uh, but even if you take everybody, let's say India vaccinates, as Dr. KK said, 30 crore people in next 2 to 3 months, we are still far behind. 30% population is still much smaller. The Israel has, as you all know, 85%. US has far ahead. UK. We have such a big population, so we need many multiple safe, effective vaccines and multiple times more vaccination strategies. So we are still far behind.
Dr. Rana, sir, what message you would like to give? Sir, you are not audible.
I shall say that fastest vaccination is the answer for the country, and we should all go without fear for vaccination. Let doctor examine if there is some high risk patient, but as such, high risk patient is not a contradiction vaccination. It is just somebody has to get it, and at any age somebody will get it. It is not a question of comorbid condition that somebody is going to get reaction. As Dr. K. K. Aggarwal told you that some people though you having energy and energy, they need to be sacrificed, segregated. The rest of the people should go without any hesitance. And I am very sure that a lot of people will come for voluntarily for vaccination now, because since the fear is over now, there will be no hesitancy. So I will just say go for vaccination without fear.
Dr. KK
I just want
Aggarwal,
to
sir, what message you would like to give, because still our speed is little slow comparative to other countries. What
So
message you would like to give,
my
sir?
message is that all those people who are going for vaccination, ask your doctor, what are my chances of developing sympathetic overactivity? Because some people may develop increased tachycardia or high blood pressure. Therefore, if they are hypertensive, take their morning medicine and go. Ask your doctor, am I likely to get an allergic reaction? And take pre-medication appropriately. If you are a patient suffering from any acute infection, unstable angina, uncontrolled diabetes, uncontrolled acute blood pressure, you are symptomatic, you are in a phase of, I say, that you are not sure whether you are having a cardiac pain or not, because we don't want vaccine to precipitate or vaccine to be blamed for any happening which may happen after the vaccine. It may be vaccine related, it may not be vaccine related.
That's
So
important.
talk to your GP, and then go to the hospital for a vaccination and take a vaccination, then follow it up for you. I normally say observe yourself for 1 day with the first vaccine and 2 days for the second vaccine. Simple way to remember, because the vaccines may be reactogenic in the first day and the second day. And those cases, 33 people in Norway and 10 people uh, in uh, uh, in Germany who died because they could not tolerate reactogenicity in a comorbid, frail conditions. Therefore, get yourself evaluated if you are in a frail situation where you will not be able to tolerate even mild degree of elevation of fever, tachycardia, or blood pressure. In that case, appropriate pre-medication may be required.
Thank you so much, sir. Dr. Sandeep Mishra, sir,
Yes.
what you would like to say about the
So,
vaccination, the message you want to give?
so I think I would like to say that whenever you get a chance at whatever level, I think go for vaccination. Only two kind of people should be a bit careful. Number one is somebody who's suffering from active disease of any kind, particularly heart disease or even high fever or some kind of active disease, because there, the reactive process may further worsen the disease, so be a bit careful. And
Means
those who are,
self-awareness is also important.
sorry?
Self-awareness is also important.
Yes, yeah, of course. And those more than 80 years of age also should be a bit more careful. Uh, if they are totally fit, then of course, if they are fit, they can of course get it done. But if they are not, then get evaluated by a doctor and then go for the vaccination. So these two groups, I think, should be a bit careful. Otherwise, everybody should go for vaccination. And I also, another message I would like to say is that don't be very particular which kind of vaccine you are getting, because as of now, whatever we know, more or less all vaccines are similar. Uh, the only difference lies in how they are prepared. That is the only difference, but the output is practically the same. Some vaccines have little less side effects, but I think more or less all vaccines are safe. So one should go for whatever vaccines they can get.
Thank you so much, Dr. Sarin, Dr. K.K. Aggarwal, Dr. D.S. Nara, and Dr. Sandeep Mishra for joining us on Medically Speaking. Thank you so much, sir.
Thank you.